You saw it? Well, good thing you found out now. Am I on?
Yeah.
Hello, everybody. We had a meeting at the health facilities, a health facilities meeting today, take two. Today we were at a health facilities meeting, an emergency meeting at Juneau here, and they were discussing the new guidelines that came down from OSHA, the guidelines for mandatory vaccinations for any enterprises that are accepting federal funds. And the committee, 3 of the 5 were there, and they discussed a lot of drafts of policies, vaccination policies, enforcement policies, compliance policies, that kind of thing. And they had to make a decision between, I say, 2 things. Either how to force all their staff to get vaccinated or how to force all their staff to get vaccinated. That was about it. There wasn't talk about any other options. I know that there are quite a few of the staff at Clearview that have chosen not to get vaccinated, even though vaccinations have been available since March or April of this year, depending what state people were in. There's a reason that individuals didn't get the vaccination if they haven't. And it's not because they didn't have time. It's because they chose not to. And now, because of federal money, anybody who works at Clearview, it looks like anybody who works at Clearview will be required to get vaccinated. They have a religious exemption here, and I looked at this religious exemption form and they read through it all. Nobody asked any questions about anything that maybe could be different. Listen to the video, watch the video. Ashley has recorded that for you, and you will catch her comment at the beginning, my comment partway through, and one of the committee members' comments. You can catch that on the video. But what good is a religious exemption when they give you examples where your exemption will be denied, and it's almost everything under the sun? I'm sorry, there is no religious exemption anymore. They're fooling you. Legally they have to provide one, but they have tightened this up so tight that you have to be awful thin to squeak through the little crack that's allowed for a religious exemption. I was there and Ashley was there. We were there for individual liberty. People should choose. You ever hear of the phrase, my body, my choice? Well, let's be selective, right? We can use it over here, but we can't use it here. I think it should be used everywhere. We were there for everybody, but especially for those who choose not to get vaccinated. That's individual liberty. The Constitution was ratified at a time of grave emergency. That's in Wisconsin Supreme Court law. This is supposed to be an emergency that we are following federal law, even though it doesn't agree with the Constitution. There is no emergency. You'll see in my comments that I make it very plain. There's no unvaccinated people all over the place killing everybody. It's not there anymore. So listen to the video. We were hoping for more openness from the committee, and it just wasn't there. They're going to have another meeting next week to discuss this further, when it looks like they're just going to just slam this through. And I did mention that if they think they have a staff shortage now, they may be seeing something even greater if they choose to go this route. They talk about how their care for the elderly cannot be compromised. I agree, it should not be compromised, but their decision that looks like it's coming is going to severely impair their ability to care for everybody in all the beds at Clearview. They try to separate the different buildings and services. Some are exempt from this guideline, but one of the committee members wants to pretty much, it looks like, bring everybody together in one big pot and just get everybody vaccinated and everything's going to be good, right? So I encourage you to watch this video, watch next week's meeting. It would be nice if you would come. There's public comment. We need people to come and say something. And I know it's inconvenient. It's going to be during the day, during the week, obviously. But think if you could make that to even provide a little comment. It is what it is. So we just thought we'd update you on that. I'm not pleased because the Constitution is not being followed. I want people to have the individual liberty that our Constitution guarantees and secures for us. But our constitutional liberties have been trampled the last 18 months, and for some reason it's not going away yet. This is not an emergency. So listen to it, pass this video around. Let's see if we can just watch the vote. I believe next week they will vote on this. Watch the vote. We must watch the vote. And remember who votes what, because in April of 2022, there's an election coming up for supervisor, and one or more of these supervisors on this committee will have someone contesting their position. So watch their vote. Thanks for following us here. We'll keep in touch with you. Have a good day.
Do you want to be paid for today?
Sure, please.
Oh, I do have one public comment, if you wouldn't mind. First of all, I'm disappointed that this meeting is even being held when 2 of the 5 committee members are not able to be present. Decisions have consequences. Therefore, decisions that will create a great amount of unrest should be heavily weighed. This discussion feels rushed for obvious reasons. The government, even county government, should not ever be able to mandate any medical procedure. Bodily autonomy is a God-given right that should be protected and upheld, especially when said procedure is not even through the full testing phase. The testing phase for this COVID vaccine will not be completed until 2023 at the earliest. In 1947, our country recognized the importance of medical freedom by writing a code of medical ethics. Here's an excerpt from that code. The voluntary consent of the human subject is absolutely essential. This means that the person involved should have legal capacity to give consent, should be so situated as to be able to exercise free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion, and should have sufficient knowledge and comprehension of the elements of the subject matter involved as to enable him to make an understanding and enlightened decision. Which brings me to my next point. On Saturday, a federal appeals court here in our great country has temporarily blocked the Biden administration's COVID vaccine mandate for businesses with over 100 employees. This should speak volumes. This mandate is unlawful and unconstitutional on its face. Medical mandates are a very slippery slope. As we see hundreds and possibly thousands of medical professionals all over the United States walking away from their passion to help others because of this unlawful overreach, I beg of you to consider the ramifications of a mandate for Dodge County health facilities. The agenda for this committee meeting speaks of a draft policy and implementation procedure. I don't know specifically what form these documents will take. But our friends and neighbors who work here should have a choice about what is put into their bodies. I personally know one individual who will quit working at Clearview if this mandate happens. Again, decisions have consequences. You will lose staff members. And seeing that we've had to implement a sign-on bonus that tells me that we are already struggling with staffing issues, please think long and hard before you make your decisions. Thank you for your consideration.
By the way, there will be no decisions made here today because we have 2 missing board members. One is out of the country and one had a previous commitment that she could not get out of.
Duly noted. Thank you.
For discussion only. Before discussion about Centers of Medicare and Medicaid Service, U.S. COVID vaccine requirements issued 11/4/21.
All right. In front of you, I did not have an opportunity this time to put together a visual slideshow, but this is the presentation that was presented by CMS Thursday afternoon after they rolled out the vaccine policy in the morning for Medicare and Medicaid. We discussed this at meetings before. This is considered a condition of participation. If we don't follow the conditions of participation, we're essentially cutting off our Medicare and Medicaid funding for the nursing home. So in terms of Clearview, you're talking 85 to 90% of our funding. So that's really how they control the purse strings, essentially. At any rate, we just want to kind of go through it page by page. We can discuss it. You know, they came up with their agenda. And then, who's included? It includes ambulatory surgery centers, rehab clinics, community health centers, comprehensive outpatient rehab centers. And as you get farther down, it's long-term care facilities. And for purposes of the mandate, if you will, it's nursing homes and intermediate care facilities for individuals with intellectual disabilities. So that right there is everything on our main campus building. Who's excluded? Assisted living facilities and group homes are excluded, along with home and community-based services and physician offices. So we're going to need to have a discussion about what we're going to do with Northview and community group home and Trailview, because they are excluded from the mandate. So we need to have some discussion as to how we want to handle that, what we want to do with those employees. Requirements, what must the facility do? You have to have a process or plan for vaccinating all eligible staff. We have ample opportunity to access the vaccine, correct? So it's just a matter of setting up some clinics to be able to do the vaccination. Staff is also more than able to go to Walgreens. I went to Walgreens and I got my booster shot. It's all kept on the Wisconsin Immunization Registry. We have to report all of our immunizations to the National Health Safety Network every week. So that's how they track whether or not our staff is abiding by the rule. You're going to have a process or plan for providing exemptions and accommodations for those that are exempt. I provided you our draft policy, our draft religious exemption form, and then our draft medical exemption form. And we'll be getting to that in a few minutes. And you must have a process or plan for tracking and documenting staff vaccination. I alluded to that earlier. All of that is kept on the Wisconsin Immunization Registry, and we have to report every week to the National Health Safety Network, and it's total number of residents vaccinated, total number of staff vaccinated, and where they are in the vaccination process. Okay, so requirements. When must my facility do it? You have to have a process or plan in place for vaccinating staff, providing exemptions and accommodations, and tracking and documenting staff vaccinations within 30 days by December 5th, 2021. So additionally, your process or plan for vaccinating staff must ensure that all eligible staff receive the first dose or one dose vaccine by December 5th, receive all shots for full vaccination by January 4th, 2022. Who in my facility must be vaccinated? All the employees, all the licensed practitioners, students, trainees, volunteers, and contracted staff. So it's essentially anybody that walks through the door. The vaccination requirements also apply to staff who perform duties off-site, home health, home infusion. This requirement does not apply to full-time telework staff. We don't have any full-time telework staff at Clearview. So how does CMS define fully vaccinated? CMS considers staff fully vaccinated that has been 2 weeks or more since they completed a primary vaccination series for COVID-19. Staff who have completed the primary series for the vaccine received by the Phase 2 implementation date are considered to have met these requirements, even if they have not yet completed the 14-day waiting period required for full vaccination. Completion of primary vaccination series for COVID-19 means staff received a single-dose vaccine, the Johnson & Johnson COVID-19 vaccine, or staff received all required doses of a multi-dose vaccine, the Pfizer-BioNTech COVID-19 vaccine or the Moderna COVID-19 vaccine. And staff received vaccines listed by the World Health Organization for emergency use in accordance with CDC guidelines. Are boosters included? No. However, CMS strongly encourages facility and staff to review the CDC's interim clinical considerations for use of COVID-19 vaccines currently approved and authorized in the United States for additional detail on additional doses. Right now, it's for severely immunocompromised and those working in a setting such as Clearview, but it's not mandated. We are, right now, the resident would like a booster that has to be ordered to their physician, correct? All right, how do exemptions work? CMS requires facilities to allow for the following exemptions to staff in accordance with federal law. Recognized medical conditions for which vaccines are contraindicated, religious beliefs, observances, or practices. So what are the basics for the medical exemptions? Facilities must develop a process for permitting staff to request a medical exemption. Facilities must ensure all documentation is signed and dated by a licensed practitioner. Documentation must contain all information specifying why the COVID vaccines are clinically contraindicated for the staff member. Documentation must include a statement by the authenticating practitioner recommending the staff member be exempted. And then the basics for religious exemptions. Facilities must develop a process for permitting staff to request a religious exemption. Facilities must ensure all requests for religious exemptions are documented and evaluated in accordance with applicable federal law and as a part of the facility's policies and procedures. How do accommodations work? CMS requires facilities to develop a process for implementing additional precautions for any staff who are not vaccinated. Potential accommodations for exempted staff would include, but are not limited to, testing, physical distancing, source control. As we discussed it internally at Clearview, testing, we would need to, because you can't test out of it like with the OSHA standard, so we would continue with our regular testing process, which because Dodge County is considered red for the sake of testing, that requires, if you have no active COVID in your building, that requires staff, unvaccinated staff testing twice a week. And then if they're in, if it's yellow, it's once a week, and if you get to green, it's once a month. And then as far as source control goes, if you're discussing it internally, if we're in the green, then it's only unvaccinated staff required to wear PPE, would be a well-fitting N95 mask and goggles or face shield. Physical distancing, we can enforce that to the best of our ability. In all cases, facilities must ensure that they minimize the risk of transmission of COVID-19 to at-risk individuals. Vaccination is the only option. This regulation does not include a testing option for unvaccinated staff. They very much highlighted that during the presentation. Facilities are encouraged to voluntarily institute testing alongside other infection prevention measures such as physical distance and source control. There are no new data reporting requirements within this regulation. Facilities, specifically hospitals and nursing homes, are still expected to continue complying with the facility-specific data reporting requirements set forth in emergency regulations issued by CMS in May of 2020, August 2020, and May of 2021, respectively. That's the reporting on the National Health Safety Network. How will CMS check for compliance? CMS works directly with survey agencies to regularly review compliance with Medicare and Medicaid regulations across multiple healthcare settings. CMS expects state survey agencies to conduct on-site compliance reviews and requirements in two ways: recertification surveys, complaint surveys. Surveyors will check to determine if a facility has met the three basic requirements: having a process or plan for vaccinating all eligible staff, having a process or plan for providing exemptions and accommodations for those who are exempt, having a process or plan for tracking and documenting staff vaccinations. Accrediting organizations will also assess for compliance. And in the hospital case, that'd be JCO. What if my facility is out of compliance? Surveyors will cite facilities based on the level or severity of the non-compliance. So what? Facilities that are out of compliance will be cited and provide an opportunity to return to compliance. If not, CMS may use enforcement remedies such as civil monetary penalties, denial of payment, and even termination from the Medicare and Medicaid program as a final measure, which would, again, that's our final structure. Interaction with other regulations and requirements. Bottom line up front, if your facility participates in the Medicare or Medicaid programs and is regulated under the CMS conditions of participation, conditions of coverage, or requirements, then the CMS Omnibus COVID-19 healthcare staff vaccination regulation takes priority, and your facility is expected to abide by the requirements. If facilities are not certified under Medicare or Medicaid programs and therefore not regulated by the conditions of participation, then the executive order on ensuring adequate COVID safety protocols for federal contractors or OSHA COVID-19 healthcare emergency temporary standard apply. If none of the above regulations apply, then employers are subject to the OSHA Employer Emergency Temporary Standard for facilities with greater than 100 employees. Lastly, this regulation preempts any state law under the Supremacy Clause of the United States Constitution. So the actions to take. Do review the omnibus COVID-19 healthcare staff vaccination regulation in the specific sections applicable to your facility. Do review the frequently asked questions document specific to this regulation in the CMS emergencies page. Do begin developing your process or plan for vaccinating staff, providing exemptions and accommodations, and documenting and tracking staff vaccinations. Do note the 2 milestone dates by which compliance is expected. 30 days, December 5th, 2021, and the 60 days, January 4th, 2022. What I have also provided for you is we have the COVID-19 vaccination policy, COVID-19 vaccination religious exemption request form, and the Clearview mandatory vaccination declination, and it's the healthcare provider supporting statement. So this is the medical exemption. And then just for in the Federal Register, for 42 CFR, Part 483, that's what governs us. This was 100, they came out with the final published document. It's close to 100 pages. I just provided pages that pertain to us for section 483. So it goes through the conditions of participation for skilled nursing facilities. So with that, what I'd like to do is I'd like to review the draft COVID-19 policy. I have Erin is here. She's a nurse with nursing. Put a lot of time and effort into this policy as we've been looking at others. So I just like to review it and answer any questions you might have. So the purpose is to protect the Clearview residents in the consideration of guidance released by CMS under the Centers for Disease Control and Prevention and a variety of public health authorities and professional organizations. Clearview is implementing a mandatory COVID-19 vaccination policy for its workforce. Clearview is committed to protecting our patients, staff, learners, and the community from COVID-19. All workforce members are required to have or obtain a vaccination as a term and condition of employment or to work at Clearview unless an exemption or deferral has been approved. All staff shall be required to report their vaccine status and to provide approved documentation as proof of receipt of the vaccine. All new staff shall be required to provide proof of their vaccine status prior to the start of their employment. All records of vaccination and approved exemptions will be maintained by Human Resources. This applies to the COVID-19 mandatory vaccination policy, and it applies to all Clearview employees, volunteers, medical staff, and any contracted individual receiving a Clearview badge and or access to the facility. In the interest of equity and our mission to protect our facility, this policy applies to all staff unless the individual qualifies for an exemption as provided herein. Exemptions may be provided to staff with certain medical conditions and on the basis of a strong religious or sincerely held spiritual belief. Deferral of the receipt of the vaccine may be granted to staff for certain medical conditions, approved and out on a block leave, date of positive COVID test or treatment, current pregnancy or breastfeeding. All staff are denied an exemption or deferral shall have 10 days from the date of the notice of denial to receive the vaccine, either a single-dose vaccine for first dose of the 2-dose vaccine. Contracts will be reviewed and attachments will be added to ensure vendors, contractors, students are abiding by the new guidelines set forth by CMS. So the definitions: staff, all Clearview employees, volunteers, medical staff, and any contracted individual receiving a Clearview badge. COVID-19. COVID-19 is a respiratory disease caused by the SARS-CoV-2, a new coronavirus discovered in 2019. The virus is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. Fully vaccinated individuals are considered fully vaccinated 2 weeks after their second dose in the 2-dose series, such as Pfizer or Moderna vaccines, 2 weeks after a single-dose vaccine, such as Johnson & Johnson's Janssen vaccine. Procedure forms, guidance, and procedures for implementing the mandatory COVID vaccine, religious exemption form, medical exemption form. Violations of this policy or associated procedures may result in appropriate disciplinary measures in accordance with Clearview general rules of conduct for all Clearview staff, applicable collective bargaining agreements, and other applicable Clearview policies, or is outlined in any procedures document related to this policy. I'd like to review the healthcare supporting statement. This one's fairly straightforward. This is the one we use for our flu policy as well. In order for a person to work, provide services, or volunteer a career due for CMS memo, they are required to obtain the COVID-19 vaccination. They are able to get this vaccination in order to qualify for a medical disability accommodation. Their healthcare provider, only a physician, nurse practitioner, or other licensed medical professional practicing under the license of a physician, must complete the following form to be provided by the person to the Human Resource Department. Note, do not state the nature of the underlying medical condition or disability. Name of the person seeking the medical disability, their date of birth, name of the physician, nurse practitioner, or other licensed medical professional practicing under the state license. Anticipated duration of medical condition, disability, or indicated the duration is unknown or permanent. By completing and signing this form, I certify that my client patient listed above shall not receive the COVID-19 vaccine due to explain the specific contraindication to vaccine here, but do not identify the underlying medical condition or disability. Attach a separate sheet or statement if necessary. I certify the above information to be true and accurate. I request exemption from the COVID-19 vaccination for the above named individual. And signed, dated, license number, contact info. They're practicing under the license of a physician and the license number of the physician. The other form I'd like to review is the religious exemption. Therapy requires COVID-19 vaccinations for all team members, including facility employees, physicians, and other privileged practitioners, students, trainees, volunteers, contracted staff, and vendors are required to get COVID-19 vaccine. If you have a sincerely held religious belief that you believe should exempt you from receiving the COVID vaccine, you must submit this form, this completed form by, and I just threw in a date. That's not written in stone. This was just for the sake of having a date on the form. The exemption request will be reviewed by the Dodge County Human Resource Office and considered on a case-by-case basis. If your request is approved, you will be exempted from receiving the COVID-19 vaccine for the duration of your employment with Clearview. If your request is denied, you will be required to receive the COVID vaccine as a condition of your continued employment. Alternatively, you may submit an appeal of the denial within 5 business days of the denial notification. How do you apply? Required. Complete the attached COVID-19 vaccination religious exemption request form. Optional. Supporting documentation. Attach documentation from your religious leader that explains why your sincerely held religious beliefs justify exemption from vaccination. Examples of basis for exemptions. Requests that will result in denials. Misinformation, such as microchips, magnets, DNA altering technology, adverse impact on fertility. Legal arguments. Requests including the constitutional, regulatory, or privacy justification for vaccine exemption. Fetal stem cell tissues or derivative materials. These ingredients are associated only with Johnson & Johnson vaccine. Pfizer and Moderna vaccines are available. Animal cells, tissues, or derivatives materials. Animal products are not used in the manufacturing of COVID-19 vaccines. Social, philosophical, political, or economic beliefs. Exemption requests must present clear connection between a sincerely held religious belief or principles and vaccination. Non-secular religious statements, quoting or citing to scripture or sacred text without a clear connection between a sincerely held religious belief or principles and vaccination. Religious texts are open to interpretation, and a religious exemption request must provide that interpretation. Where do I send my request? Again, this is just a working document, but we feel a good first step would be to submit the documentation to Sarah in HR. My religious exemption was denied. How can I appeal? A team member who is identified or who is denied a request for religious exemption can appeal in writing within 5 business days of written denial notification. This appeal can be emailed to Jim Milky. If my exemption request is approved, what will I need to do? If you are granted an exemption to the COVID-19 vaccine based on sincerely held religious belief, you are required to comply with the following conditions in order to remain employed. Oh, that should be clear. You must comply with Clearview guidance on PPE use, comply with current Clearview guidance testing requirements, must complete the current daily COVID-19 symptom screening prior to entering Clearview. Who do I contact for more information? Email all questions regarding religious beliefs to Sarah Hindy. And then on the back, that's the request form. It includes your name, your employee ID, department, date of birth, phone number, email, address where we may communicate approval denial, and then just Check 1, if you're a team member, volunteer, contracted staff, or others. I am requesting religious exemption. I will explain those sincerely held religious beliefs below and will attach additional pages if necessary. I understand that there must be a clear connection provided, explained, between my sincerely held religious belief and the justification for vaccine exemption. I will include information that supports my religious belief as sincerely held and practiced in my life. Consistent practices over time, applies to practices and behaviors other than vaccination, influences healthcare decisions. And then a signature line and date. So that's what I have, and I'd like to start opening it up to the committee for different discussion.
I just have a couple changes, very small.
Okay.
One is just super tiny grammar.
Which one are you looking at?
I pinned out just a white piece of paper with a highlight.
Oh,
So instead of that, it should say big, nothing big. On the opening introduction, it says to protect Clearview residents and consideration of guidance released by CMS. And I think that we should acknowledge, it's not guidance. Our facility is subject to losing our funding. It really is a requirement of the center, Medicaid and Medicare services. It's right at the top of the document that is the Clearview vaccination requirement. So want to make it clear that the purpose is, number one, to protect Clearview residents, but number two, we're required to do it. We're not just choosing it as a, hey, we have a choice to do it or not do it. It's a requirement of maintaining Medicare and Medicaid funding. I just think we need to reflect the reality that Clearview's choices are extraordinarily limited here.
so you're suggesting the opening line be
I
current
put in
language
that.
to protect, change it to protect Clearview residents in consideration of requirements released by CMS and guidance. Okay.
Yeah, there is other guidance, but this is due to a requirement. So I think we need to recognize that.
Kim has a comment.
Just for the committee's benefit, over the weekend I had a chance to review the policies and the EEOC guidance and actually the federal rule. So it's a really good point that you make about our policy needs to be reflective of that, the fact that this is a federal rule.
Right.
This isn't a guidance, it's not recommendations, it's a mandate. And so just, again, for the committee's benefit, there's a bunch of things in the policy. This is just here for your draft and discussion. It's presented in draft form. I have a number of things that I would like to redraft and rewrite, and that's one of them. We need to cite the CMS rule, the federal rule, and we need to be reflective of language in the federal law. So I'm not going to go through all my changes, but we'll talk internally about it after today's meeting and
not
work out
necessarily
the draft of the rule or the draft of the policy as well as the exemption requests and present them to you.
And obviously, and I know you're going to do this, it's not that we are required, period, it's just as, a requirement of funding. I do appreciate the valid concerns that you folks have about restriction of your liberty. And I believe that's a valid concern, and it's a real concern. And so our committee does not take this lightly. And it's really hard when you talk about the Constitution, right? It's hard because, it's just this tiny few words and one little clause spawns thousands of cases. So one of those little clauses is called the Supremacy Clause. And essentially, very broadly means that federal law requires states follow it. And to the extent that state law is in conflict, the state must follow federal law. And otherwise, we'd be back to 13 colonies where, anybody could do whatever they wanted. And we wouldn't be the United States of America if we didn't follow federal law. It's part of what unifies us. So the Center for Medicare and Medicaid Services is saying, as our executive director here made very clear, that if we do not do this, then we're going to lose our funding. And frankly, less
Our
than
license.
Are licensed, right, sorry, which would then,
Both, we lose both.
we lose both. So it's really frustrating and it's difficult, but I don't think we have a lot of options and we don't have a lot of choices. Also, you asked us to think really carefully about, you know, what is the response here? What is gonna happen? What are the consequences of our decisions? A, less than half of all counties in Wisconsin have a county nursing home. It used to be a given, it's not anymore. So when people are here in our nursing home, they aren't and cannot live at home, and they can't live in an assisted facility. This is the only place they can get care and be alive and live. It's the highest level of skilled nursing care. When this closes, they have nowhere to go. So if an employee wants to work somewhere else, I understand that's a difficult choice. I guess I'm looking at the choices of our residents. They don't have a choice to not be infected by someone who is working for them and bathing them and cleaning them and feeding them. They can't be taken care of 6 feet apart. And so that's why, to my knowledge, the appeal to the whole federal government on this is not nursing homes, it's private businesses, because those businesses are not required to take care of people who live there and for whom they are responsible. So, I understand the chairman isn't going to make a decision. I don't understand. I'm assuming we're still going to submit our policies by December 5th, or we're not in compliance. So at a minimum, we have to make that decision.
Well, it's not to submit, we don't get submitted to anybody, you just have to have
Okay.
it completed
All right.
and implemented.
Okay, because I was like, okay.
No, we don't
wanna
submit them to anybody.
I don't want to start out.
What
not
happens
being
is
compliant.
when they come in for their survey inspection, they'll ask to see those policies, just
Okay.
like they do for our infection control policies now, when
Okay.
they come in, when they do their federal infection control surveys.
All right. So I guess you guys have any comments you have?
I do have one question I want to pose before the committee, because assisted livings and group homes are specifically, they're specifically omitted, because although they receive family care funding, that's done through, it's a different process, it's a waiver process. So that's why that's why CMS doesn't necessarily license them. They're licensed through the state.
I do have a feedback on that. So I also sat in because Ed was very generous to send the committee links, whatever, to attend the national explanation of these benefits. So I watched that along with 10,000 other people. And I think that rule applies to assisted living facilities, and again, council can check this, but generally nursing homes are not all connected to assisted
If they're on the
facilities.
same campus, then yes.
Right, and so.
Well, if they go inside,
Right.
if they cross the building.
Correct,
And
but we
that's-
have people that cross over.
Well, that's why I wanted to talk about that. Not all of them do.
Right.
And one of the options we would have is if somebody wanted to, if they drop to an HA1 status.
Yeah, so we've got, HA1s are the CBRF certified assistants. They're not required to be CNA certified. So we do have individuals who meet that requirement, along with our CNAs who also work between both buildings. So if it's decided that we're not going to mandate the group homes, essentially a CNA can demote down into a assisted living one and work solely in the group home.
So my concern with that is that we, like other nursing homes in this country, are extremely short on staff, extremely short. And part of our ability to maintain care for all of our residents has been to allow, when there's a shortage, somebody from the nursing home can go down and work at the assisted living facility. So there's an ability to be flexible and to provide care. And we lose that if we sit here and pretend they're separate, because they're not separate, they're integral to Clearview.
Unless, if they want to maintain their CNA, because the CNA requirement is something we impose on them, it's not a requirement
I know.
of licensure. So if they want to maintain their CNA license and operate as a CNA over at the nursing home, they would have to comply with vaccination requirement.
Correct.
Um,
That's why I'm saying if anybody
but
goes
to be
in,
fair, in terms of recruitment, dropping the CNA requirement might help with recruitment to the assisted living, because there are lots of unlicensed staff that, they just don't have an interest in getting their CNA license or maintaining the 12 credits, 12 hours. Do you have to do every year?
Yeah, actually, this is 15.
can you say that again? I didn't hear you.
So every year, they have to do 2 CNAs in order to keep their license, need 12 hours of in-service and 8 hours of working as a CNA to get their license renewed. And at the homes, they have to have 15 hours. They have to get 3 hours specific to, something specific to assisted living or.
So I guess I think this committee should think really long and hard about lowering our standards of care for people in assisted. And it's not, we're not lowering it below the minimum, but we would be lowering our standard of care that we currently have now. We do not require CNAs, but there are plenty of CNAs that are working in the assisted living, and they have training. And I just don't see this as some huge burden to get 12 hours a year. We really need to think very hard about the quality of care that we are giving, not just to the nursing home, but also to people who are in the assisted living facility. And that's the first thing I thought of is, oh, they're going to try to separate out the assisted living facility, but we lose a lot of flexibility when we're short and it's late, and then we can't pull someone, you know what I'm saying, over, or somebody calls in sick, we can't pull somebody over from the nursing home. And that has, I was on when I think when we started that, it's been a long time, and it's been a very, very valuable way to help continue the minimal level of care across the whole Clearview campus. And I think we should think very long and hard before we do a decision that lowers our standard of current care. I mean, what is our standard? Is it just the bare minimum? It's never been the bare minimum. Clearview has always tried to give exceptional care. And I think that's the most important thing. Our residents deserve exceptional care.
So it's not a decision you have to make today, of course.
Correct.
And it would be a really good decision, of course, for the whole committee to hear the pros and cons about, but it's something to keep in mind, whether you're going to extend it to the Northview and Trailview, and consider it one campus, or whether you're just going to, because it's not mandated by the rule, whether you're going to just have those be separated out and not impose policy on the employees that work there. So,
Well, it is currently, I mean, we're not considering, are we going to keep them separate? We're considering a full campus that's fully integrated, and we're considering separating it, and that's different. So,
so the committee will want to have that discussion at your next meeting. And think about the pros and cons to doing it either way.
do you have any comments?
I think you're pretty well covered the necessary documentation here with a few tweaks. I don't know what else we need. Yeah.
Yes, I just have been listening here and just have a few comments for the committee to consider. I understand about the Supremacy Clause, but the constitutions of the state of Wisconsin and the federal constitution are supreme over state and federal law. Our founding fathers never acquiesced to the king's law, and I think we need to step back a little bit and really look what's happening here. First off, as I look even at the nation, there is no pandemic of the unvaccinated. I mean, 50% of our nation's citizens have been vaccinated, and a good majority of the rest have either gotten it, they have natural immunity, and it's tragic that natural immunity is not even in the picture here. And I think Ed summed it up real good when he said, this is the agenda they came up with. They came up with. And we're supposed to just roll over and abide by their agenda in Washington, D.C. We're here in Dodge County, Wisconsin, It's a different area, different people, different everything. And I think we need to just back away and realize that there is no emergency here even. There is no pandemic where thousands and thousands are dying within a month. Last year in April, it was uncertain, obviously. Nobody knew what was coming. So there were a lot of knee-jerk reactions. And now, a year and a half into it, when vaccinations have been out in most states since April of this year, and all these people are vaccinated, now we're told this is an emergency, and 2 months ago they could have done this. They didn't. They talked about it. And now they've brought this forward, and they say, well, we're not going to hold you to it for another month or two. That's no emergency in my eyes. There's something else going on here. The Constitution and individual liberties have been trampled for the last 18 months. And I think that's a travesty, number one. And this is going to continue down that road. I think we have to take a little time to think about this. Is vaccination really the only option as they present here? If you aren't vaccinated, you're not going to be protecting these individuals. So why is it then that fully vaccinated people still get COVID? Fully vaccinated people still can give COVID? Fully vaccinated people are still supposed to wear masks? Fully vaccinated people are still supposed to social distance? So you tell me, what's the difference between fully vaccinated people and unvaccinated people according to the CDC and whoever else in the federal level supposedly knows all this stuff and so smart? They found out that government can't stop a virus. I think a lot of us knew that a year and a half ago. But that wasn't going to stop them from trying. You do this, you do that, you do this, you do that, you stay home, you close your shop. What happened? The states that were locked down the tightest, the ones that were vaccinated the most, the ones that were the most proactive to stop this virus, the virus just ran right through the states. Michigan, it didn't make any difference because a virus is going to adapt faster than we can try to knock it out. So now we have all these vaccinated people, and we have all these people that have received COVID naturally. We have all this immunity out there, and now all of a sudden we're pulling out all the stops. And we have a staff shortage at Clearview and elsewhere. And now we're going to tell these, 35–40% of the staff at Clearview who have chose not to get vaccinated, they've had ample time. It's not because it's not available. They just chose not to do it. And I'm here to represent those employees who said, stop. No, this is wrong. This is unconstitutional. Did we ever hear the phrase, my body, my choice? Or are we selective on how we apply that? I fear, and it's up to you all, but I fear if this is pushed, you're going to have a new realization about what a staff shortage is. We don't want to minimize our care of our residents. There might not be a choice on some hard decisions here because a lot of these unvaccinated staff members probably are safer to have around your residents than the fully vaccinated ones, but nobody's going there. So,
I'm going to ask you to sum it up according to our 3-minute rule.
oh, I didn't realize I was on public comment. Thank you. So vaccination isn't the only option. I urge you to push back. Just like our founding fathers pushed back. They didn't just acquiesce and roll over. Don't jump because they say jump. And don't say, how high should I jump? This is America. This is where we're supposed to be free. And this is where we're supposed to stand up for individual liberty, or else we can go live in China. Go ahead, if you think it's so great. Go somewhere else. But let's really step back and look at what we can do here for all our employees not for the CDC. Thank you.
Mr. Chairman,
Yes.
I'd like 30 seconds. I'd like to ask, just to say for 30 seconds, I understand the disagreement on the facts, but your statement of the law, especially to people who are going to watch this videotape, or whatever portion you decide to put online, is absolutely incorrect. The Constitution of the United States, which every one of the three of us swore to uphold, does, in fact, overrule every single state constitution. Because we already had the revolution in 1776, and we broke away from Britain. We're not breaking away from ourselves. And as a country, as a supervisor, in spite of all of the numerous emails I get threatening that they're watching me, I'm watching you, great. You're gonna watch me follow the Constitution, because honestly, Supervisor Siegman, what you are proposing is not legally constitutional. Just because you say that the state should have supremacy does not make it so. And in fact, the law has to generally follow precedent, right? It's the way we have stability and not chaos. 1905 Supreme case already said, yes, Mr. Johnson, you have to get vaccinated from the smallpox or pay your $5 fine. He lost the case because the court said sometimes the mandate for all is for the benefit of all, essentially. I don't understand why you minimize the Center for Disease Control. It's the most sophisticated agency that does this kind of work in the entire world. In the world. We didn't follow our own CDC rules. Forget that. Way back when, but forget that. The bottom line is 13 out of every 100,000 unvaccinated people have been dying. As of August, 13 out of every 100,000 unvaccinated. Less than 4 of every vaccinated person out of 100,000 has died. There's a significant difference between those who are dying and those who aren't. That's just a fact that you can choose to believe or not. But we take your concerns seriously, but we do have to follow the actual law, and we're going to do that.
Okay, I know that the OSHA, the Fifth Circuit Court of Appeals and their finding on the OSHA rule was going to kind of mess people's idea. And people have to understand that the OSHA rule and the CMS rule are completely different. They're apples and oranges. The OSHA rule was specifically for private companies with over 100 employees that weren't healthcare workers. They're just general employees. The CMS rule somewhat follows and actually is less restrictive than the Maine rule. So Maine put out a rule that says all healthcare workers without religious exemption. They did not allow religious. And published on October 29th of 2021, currently. They did not get injunctive relief, and by a 6-3 margin. So really, the Supreme Court, what CMS is asking, is less restrictive than what the Supreme Court allowed. So the odds are that this will pass muster in the Supreme Court. They will not hear it, that this is the law of the land. That is the Constitution. Thank you.
Again, for the committee's benefit and based on some of the comments, it is absolutely right that the OSHA rule is different from the CMS rule. The OSHA rule is currently being litigated not only in the Fifth Circuit, but there was a filing over the weekend in the Seventh Circuit, which governs Wisconsin and our district, our area. But that is not the CMS rule. So the CMS rule is different. It is, as Supervisor Marsick says, a little less restrictive than the OSHA rule, and you should not be concerned about the pending litigation with regard to the OSHA rule. We still need to move forward with a policy in regard to the federal rule that came down through CMS.
Was this our only item on the agenda today? I just want to, I don't know when our next meeting is scheduled, if I could ask.
That was a topic of discussion. We were considering something next week. One is Supervisor Hilbert will be returning next week, correct?
I have not heard.
I have not
Later this week. Later this week. December or November?
I'm just glad we're meeting sooner, because I am leaving in December, and I didn't know when Dan would be back.
Yeah, you'll need to get this wrapped up long before that.
We need to do it before December meeting,
I would,
I'm assuming.
I'm sorry, say that again?
Yes.
We need to do it before our December meeting.
Yes.
December 5th is the deadline. There are two deadlines.
Correct.
December 5th is the first by which we look at policies.
And we need to allow some time for those who want to file for religious exemption, to file for it, and if, you know, if it's denied, that they have an opportunity to appeal.
That's a January deadline, right?
No, December 5th.
December,
December 5th, I
the
thought,
first one.
was just to have policies in place.
No.
No?
The rule is that they have to have at least their first, that's why January is the deadline, is because there needs to be time if people want the 2-dose series
Mhm.
to get the full 2 doses in. So there has to be 30 days, 28 to 30 days between the 2 doses. So they're giving December 5th, people either need to decide whether they're gonna have their first vaccine of a series in. And then January 4th is the deadline where they need to be vaccinated.
Honestly, we should go back and look at that. That's not what I heard on the hour-long presentation. There were two deadlines. The first was just to have policies in place. And they asked that specifically. The second one, January 5th, understand, they don't have to have that 2 weeks in by January. They don't have to be vaccinated. They just have to have the shot at the end of the second deadline, and then they can go their 2 weeks afterwards.
If you go to page 6 from the presentation, additionally, process or plan for vaccinating staff must ensure that all eligible staff receive, first bullet point, first dose or 1-dose vaccine by December 5th, 2021.
Okay.
And by January 4th, to receive your second dose.
So then, if that's the case, then why are we not voting on this? Because we have a quorum. But you wanna have another meeting when if Dan can be back, you wanna have another meeting, you can do that?
I would recommend you have another meeting. I wanna make sure that I go through the policy and.
Sure.
With the fine tooth.
So we can approve the final version?
Yeah, so I wanna make sure that you have a final version in front of you with all the members present.
Okay,
How much time would you like?
I
Couple
think,
days, week?
I think the idea is to have a meeting next week, if that's possible. I don't know what schedules look like and Dan's availability.
I'm not available Monday. I planned on being off Tuesday, but I can be here if I need to be.
What do we have next week?
We have to match up schedules with the.
Yeah.
Yeah.
we have a county board meeting on the 15th in the evening for the county. But that's just for the 17th, sorry, I don't have my glasses. Sorry.
Joe has a question.
Thank you. I just have a question. What happens to new employees that are hired after the 5th? What's the rule regarding them then?
From what I understand, they have to be vaccinated before they start.
They have to come vaccinated or they have to have a valid exemption.
Okay.
So, and that's kind of, Sarah has been involved in the discussion, recruiting materials need to reflect that.
Okay.
And there's gonna be a lot more information coming out this week in terms of guidance. We have a meeting with, there's a regional meeting with the state on Wednesday.
Wednesday, what day?
I'm sure they'll be discussing implementation and, you know,
Wednesday the 16th?
no, Wednesday the 10th.
This Wednesday.
Oh,
8:30 in the morning, we get to spend the morning with them and they'll tell us how they plan on enforcing this.
all right.
When does leading age have something, they were gonna do something and review things? I was just wondering
You know,
if
they sent something out to us last week, I think I passed that along to you. And then, they'll just keep coming out with things over the course of the next week or two. There's, you know, they have concerns too about the implementation of the policy, so.
So-
And again, if this is the final version of what we're doing, I'd be kind of surprised because, but I don't know.
Well, she has changes, so I'd be.
No, the actual rule from.
All right,
I don't know if they're gonna tweak it between now and then or not.
It's not the final version.
okay.
This,
I'm sure it's not the
Yeah.
final, they've gotta have a public comment period, it's not gonna be the final version.
But
I thought I read about public comment, I thought
But
that
in
was
terms,
already.
but as far as we're concerned, you know, this is the law of the land for us, and we have to move forward until they change it, and then we have to change what we're doing then. That's just kind of our life.
Do we have any idea of the I mean, obviously you know, but I did not know he was coming back. Do you know when he's going to be back?
Mr. Gilbert,
Yes.
it's my understanding he will be returning on Thursday the 11th, but that's what I've been told, but
So maybe something next week, maybe Wednesday.
Tuesday or Wednesday.
I don't know if you wanna pair it up with your strategic planning meeting. Do something before that meeting, it's 5 or 30. Just, totally up to
Next
you.
week, Wednesday?
When was strategic planning?
6:00.
On the 17th.
Okay, and we can do it.
No.
Well, it's the 10th.
It's the 10th, I'm sorry.
Yeah, it moved, he wasn't, because it's not on my calendar, and I'm going, ooh.
It's this week.
It's the
It's
tenth.
this week.
Yes, I have it.
Is the 17th regular county board?
No.
No.
Oh, there is no county board, it's 17th.
Jim,
One
That's what they
possible
just-
option would it help to maybe select 2 dates or time, and that way, when there's communication with Dan, when he returns, and Haley, there's trying to get some consensus, maybe based on your schedules today, if you could look at maybe 2 options for next week, and then it can get narrowed down from that.
Somebody made the comment to try to get in, like, maybe if it's at 6, we could start at 5:15 or something, whatever you wanted. I'm saying before that, on the 10th, if you wanted.
Well, Dan
That's
is
this
back.
week.
Yeah.
Oh, that's this week, sorry, that's
That's
wrong
all,
thing.
that's all.
Nope, nope.
Yeah,
Sorry, sorry, he's not back, sorry. So there's no meeting really then that week per week, it's meeting.
This week, I don't think so.
All
Probably
right,
With county board next week.
not. No.
No? None?
I don't get county board.
None next week?
No, you're free after the 10th.
I thought I had,
You're
I
Carol.
thought there was another one next Tuesday.
No.
No, we have
that's what was
HR.
moved to the 10th.
HR.
No, for sure, not.
That's at 9.
So is it possible we could do something, like one might be like at noon and one could be later in the day? And then they could each decide,
It's up to you.
I don't know, what do you think?
Meetings?
To offer, you said to offer two meetings.
Oh, 2 meetings, oh.
2 options,
Yeah.
not 2 meetings, 2 options.
I mean, I was like, yeah, you said 2 meetings.
That's what you want.
No, one
It
meeting.
works for me, yeah, like I said, any day but Monday.
why don't you do like you did this time, email us with 2 choices?
Well, I'm saying, what are 2 choices you can
Yeah.
make? So the 3 of us could be
Right,
covered.
it would.
Yeah, so like,
Yeah,
for
it'd be helpful
example,
if the 3 you could come up with.
Wednesday at noon. Wednesday, February 18th at noon could be one option. Is that a time the 2 of you could make potentially?
Yes. I prefer not
As far as
8.
I know.
Okay, she's happy without 8, so I'm gonna write
I prefer
potential.
not 8. I'm still.
Okay, so Wednesday, November 17th at noon?
Sorry.
We're much more flexible, we're something.
That's
Usually
one.
we might have court.
I said Wednesday the 16th, and I'm in the wrong month. Good Lord. November. Wednesday,
That's one option.
so Wednesday the 16th at
No, you're in the wrong month.
Wrong month, yes.
November.
Go back to page.
November.
wanna go home. Okay, so I cannot do that day. I'm doing a pro bono clinic, and, yep, I'm in the right week now.
Next week is what we wanna offer,
Yes.
so. We'll look at that week.
Yeah.
Something around the HR committee on Tuesday, I know you're.
When is that?
Tuesday at 9.
Correct.
The 16th.
16.
16th.
15th.
I don't,
Tuesday the
tell
16th.
me what day.
Yes.
And 2 of our committee members are on HR, so.
Yes.
And so they're gonna be here at 9
Good.
for that, for those meetings?
Hope so.
As far as we know.
And then
To the
how,
best of our knowledge.
I'll be,
how long do those meetings go so that we could put a tentative meeting for after that?
It all depends.
Right, whatever.
Depends on Sarah.
We don't have a lot going on, so I
Other than
would
this.
say.
First time ever.
Hour and a half, or
So,
10:30, 11.
10:30 would be good?
You can notice at 10:30 or after the.
We can notice it at
Kim's got that language, right?
10. Shorter. You can always start after 10, you just can't, if you notice it for 10,
Would that be here then?
yeah.
Yes.
Because you can always start later, but you can't start earlier.
Fine, I'll put 10.
Kim has the language that they utilize.
11:16. 10 a.m.
And that's a possible tentative.
And then did you say you wanted to do a second?
Yes, that was your
And then the
suggestion.
17th is just an option, not
The
another.
17th, you said you weren't available, correct?
No.
She was on the wrong.
I was on the wrong whatever.
How about Wednesday? Or
I'm
Thursday?
making this appointment. And if I don't, I won't be here. Okay, so that's tentative. Wednesday's totally gone.
Is that optional yet?
I'm out. I'm doing the pro bono plan.
Okay, Wednesday, you aren't.
Available all day.
How about
Okay.
Thursday? Unless you wanted to try later in the day, Tuesday.
It'd be nice for the committee members if we could piggyback.
After come back.
Pick a different day then.
How about the 18th?
I don't wanna sit here.
Well, we've got Tuesday, right, as a tentative?
Correct.
All right,
And
and
then
then
later in the day means
how about later on Thursday? Like,
Thursday would be fine.
All
That's
right.
another option.
Wednesday, the
you want to do 3:30 as an option? Is that all right?
Whatever works for you.
I mean, is that, I don't know. I can do sooner, I can't do later. So if you want to go sooner on Thursday, I could do that. So what do you want, Karen? I gave the other date, which do you prefer? Okay, I can do the morning on Thursday. Do you want to do 9 for parents' benefit? You don't have to get up.
I like 9.
Let's let her have
I
9.
just-
Let's do 9, yes. We want her to be fully
My
present.
system does not wake up well.
Okay.
That's why I retired.
Okay. 9 o'clock.
Just the way my body
Nope, I hear ya.
system works.
So Tuesday at 10 or Thursday at 9.
Correct.
Both are tentative, we're not doing both.
Tentative, tentative.
Unless,
We'll send out, or Jill will send out an email asking what works best for all the committee members, and then she'll.
That would be great.
actually, you could just send it to Dan and then tell us the final date.
See what they have here.
Yeah, send it to Dan and Haley and then give us the date. We're obviously on board and I have like 500 emails. I don't need another email.
Tuesday the 16th and Thursday. the
I just need one to tell me the date of the comment. That'd be great.
What the hell date is today? The 8th?
Okay, is that it, Mr. Chairman?
Okay. I was just going to make one comment, yeah, with regard to, we talked about our rights under the Constitution and everything, and we all have individual rights, but along with those rights and actions come responsibility that we have to both ourselves and to our fellow man. And I just think that should be considered, thought about and discussed. And once we take residents in under contract, we have a responsibility to them to do everything we can in our power to give them a safe environment. And some of those choices we make, either in our employment or whatever, then has, with that right to be an employee comes a responsibility. And the environment that we choose to work in has some responsibilities with it. I'd just like to address that issue as well. They go hand in hand. It's a balancing act. Thank you.
Any other questions or comments? Otherwise, I'll accept the motion to adjourn for our tentative meeting next week.
Next week.
Next week.
Next week.
I'll make that motion.
I'll second.
Motion made, seconded, all in favor?
Okay.
Aye.
Opposed? We're adjourned.